Today I'm going to talk about child and adolescent suicide. This is Samantha Kirpsky. She's 6 years old, and so she was 6 when she committed suicide. Suicide is something we hear about a lot, but we don't hear about it so much in children and adolescents. This little girl had gotten into a fight with her mom at dinner time. She was sent to her room to be in a timeout, and she used a belt to hang herself on the crib in her bedroom. This is the youngest child that I know of in all my research that I could find that has committed suicide. And then I have an 11-year-old, an 8-year-old, and a 9-year-old down here who have also done it. It's actually something very common, just nobody likes to talk about it, or nobody knows that much about it. I found this. This is specific to Iowa. Every 20 hours in Iowa, somebody dies from suicide. This is all ages. This isn't just children. And ages 15 to 34 is the second leading cause of death in Iowa. And then the third leading cause of death in Iowa in children ages 10 to 14. So I wanted to talk to you guys about people that are most at risk for it, warning signs to look for in children, and then some of the resources we have in Iowa that will help us prevent this from happening. I found a study from Brown University that there are 50 to 100 attempts. So 50 to 100 different people will attempt suicide to every one successful suicide. So if somebody is committing suicide every 20 hours, that is quite a lot of people that are attempting to. They say that children, that you want to look for kids that are extra sad, any type of drug use, if they've experienced any type of physical or sexual abuse. Sports involvement was one of them, which I thought was kind of weird, but it was more of if they had a serious sports injury, it was more neurological, which could lead to like psychiatric disorders, mood disorders, anxiety, stuff like that. And of course, if they've had any type of history of attempt, they're more likely to have a future attempt. And then these are the warning signs that I found. This is really important for us to look for, because 80% of people who are successful at committing suicide have talked about it or given some type of warning sign to somebody, whether it be a family member, a friend, a healthcare provider. They've kind of hinted at it in hopes that someone would notice. So this is important for us to just be on the lookout, like if they've made threats about it, if they've mentioned it, like especially for kids, if they start giving stuff away that's valuable to them, like sports trophies, stuffed animals that mean a lot to them, anything that their family has given to them. If they're engaging in risky behaviors, if they're a very cautious child and then all of a sudden they get kind of dangerous with the way they play outside with their friends, any type of drastic mood changes. If they're usually a pretty easygoing, happy child and then all of a sudden they're very angry, very sad, they can just go from one extreme to the other. If they like to hang out with friends a lot and then all of a sudden become very isolated, they just want to stay inside, they don't want to do anything. Those are just very important things to look for. And then these are just some resources that we have in Iowa. Of course, ourselves, friends, family, just always be on the lookout. Healthcare screenings, I know as adults, we're used to, like when we go for checkups or any type of visit now, they really stress that they ask their patients, do you feel sad? Do you have any thoughts of suicide? I had spoke with Dr. Chandra, one of the peds, his nurse, and she said they start screening kids in 3rd grade. So there's the Suicide Child Risk Assessment, and this is just sample questions, things that they ask. They'll ask if they know what it means to die, if they feel sad, if they've ever thought about killing themselves. If they were to die, do they still get to go to their friend's birthday party next week? Kind of just to see if they understand what that means and what the severity of it is. There's also a group here locally, it's called Alive and Running. And it's just a group that people can reach out to if they've ever experienced suicide, someone close to them, and they just need a support group to go to. And I have kind of some handouts from them that they give to people. And then there's a psychologytoday.com is an online directory of all the therapists in the Cedar Valley. You kind of get like a background on them for children. So you can get to know them before you go to see them. And then of course there's the hotlines. There's the 1-800 numbers that are 24/7. And then kids are all about their phones nowadays. So they now have a service where you can text them anytime from 2 to 10 o'clock at night every single day, just to kind of reach out to get some help. So I passed out some of those hotlines and then just like a sample survey. So if you guys have any questions, just let me know.